Welcome back. We're unpacking the latest data from some of the provinces, because it's not easy to get this data, but of Canadians who've died while waiting for treatments and procedures and testing. And joining me again is Colin Craig, president of secondstreet.org. Colin, you have a handful of provinces from which you've compiled data. You're still waiting for more big report coming out in the new year. Saskatchewan, though, you have data from Saskatchewan. Is it the same story like Ontario and New Brunswick?
Well, it's more similar to New Brunswick in that it covers a wide array of procedures. And it was about 385 patients in Saskatchewan that passed away last year while waiting for various healthcare services. In the Saskatchewan government, when we get this FOI, they often note that, well, a large number of these are cataract procedures, to which, as we just talked about, Tanya, we certainly wouldn't discount that because these are real people who are struggling with their vision in many cases. And you don't want to spend the final years or days of your life with cloudy vision. So
No.
certainly not positive news from Saskatchewan. It's down a little bit from the year before, but I think really what these numbers speak to across the country is that we need reform. I mean, we've been spending decades pouring lots of money into the system, and we're just not getting good bang for our buck,
Well,
despite the fact
let's talk about some of that reform. I know we've had you on before, and you have several ideas of how things could become better. So let's
yeah.
let's talk. What is the number one thing the government could do? Maybe the easiest thing. I don't know, to make things
Yeah.
easier so that people just stop dying on wait lists.
Well, I think the first thing is to track the data and be accountable about it. So, as we've talked about, there are a number of bodies in this country, healthcare regions and hospitals and that don't track the data. Quebec is especially bad. And then we find other provinces where we get it from some health regions, but not others. Manitoba would be an example of that. But so the first step would be to track the data. The second is the accountability related with it. If you think about what the government expects private businesses to do, they set the bar extremely high. But then when the government has to set the bar for themselves, this won't be surprising, they set it extremely low. And what I mean by this is, I'm sure all your viewers can relate to hearing about a restaurant that has had a health and safety infraction. Maybe they weren't keeping up cleanliness standards with maintaining food, whatever the case is. And you'll hear about it in the news because the government tells everyone, look, this restaurant, they didn't meet our standards or whatever it is, right? And you might walk by a restaurant and see that there's like a little notice in the window, right? Notifying everyone about the mistake that the restaurant made. Well, to what we were just talking about, what happens when the government accidentally lets someone die on a waiting list because the government didn't get them health care in time?
Oh my goodness. Yeah, there's no
Do
warning.
hospitals have to put up little notices? I mean, the government doesn't do that. They don't even disclose this information. They don't even look at it. So the government sets the bar extremely low for itself and sets it extremely high for everyone else. And certainly it's not just the restaurant sector where they set this bar high. I mean, you look at workplace safety and health accidents and so forth. I mean, this all gets reported for businesses, but governments, it's just a different story.
And is this typical of other other countries, excuse me, where they have universal health care that they just simply not only don't track or analyze rather the data, but then there are no warnings slapped on the hospital or the doctor for that matter?
That's a very good point. I'm not sure what other countries do. I know we were in France earlier in the year talking with them about their healthcare system, and I raised this point. I said, well, what happens? And they kind of scratch their heads because it just doesn't really seem to occur over there. They've got a
Wow.
better run healthcare system in France. I mean, it's not without its flaws and problems. I mean, I don't think you're going to find a healthcare system that's perfect, but they don't have the wait times like we have in this country, the constant rationing and long periods of pain and suffering that Canadian patients go through.
My goodness. So we speak of this double standard. It sounds like a double standard, like rules for me, rules for
Mhm.
thee. Do you think there will ever be impetus for the government to put out these kinds of data or publicize? Probably not, because they just want to keep running the system.
I think there could be. I mean, especially when this would be something that an opposition party would, I suspect, promise rather than a government promising to do it because it's bad news and not government. Political parties often talk a much better game when they're in opposition than when they're in
Yes.
government. So, I mean, we did see the British Columbia Conservative Party. I believe that this was something that they promised to be transparent about if they formed government. They weren't successful in the last election, but I think the more that we talk about this and point out this double standard, that eventually it will become something transparent. I mean, for goodness sakes, it's incredibly important. Governments should be upfront about this. I mean, they should want to know what's going on and minimize these cases. So
Right.
we certainly hope that we see more accountability in this area in the future.
And we'll talk about this in the next segment, but ultimately it comes down to choice. I want to have the choice of where I get life and death treatment. Anyhow, we'll pick this up in just a moment.